Perhaps part of the reason we're not able to make any headway with the coronavirus pandemic is that the experts don't agree. Some do, however, and what they are disputing is the assertions of the World Health Organization that there's no evidence that COVID-19 is an airborne disease. The WHO has said throughout that the virus is primarily spread by large respiratory droplets through sneezes and coughing and that they quickly fall to the floor. But 239 scientists in 32 countries have showcased, in an open letter to the WHO, that there is evidence showing that smaller particles can infect people. They are asking the WHO to revise the recommendations. In its last update published June 29, the WHO said airborne transmission of COVID-19 is only possible after medical procedures that produce aerosols or droplets smaller than 5 microns. They believe proper ventilation and N95 masks are only needed in those circumstances. They are relying more on hand-washing advice. The WHO's technical lead on infection control, Dr. Benedetta Allegrenzi, believes the evidence of the disease being airborne is unconvincing. Especially in the last couple of months, we have been stating several times that we consider airborne transmission as possible but certainly not supported by solid or even clear evidence, she said. This is a strong debate on this. But the other experts see it differently. They believe whether the virus is through large droplets from a cough or a sneeze or smaller droplets from exhaling that can go the length of a room, it's being spread through the air and can infect people when they inhale. They'll die defending their view, said a WHO consultant speaking anonymously. But even the agency's supporters believe the committee could stand to make some changes. I do get frustrated about the issues of airflow and sizing of particles, absolutely, said committee member and epidemiologist at the University of New South Wales in Sydney, Mary-Louise McLaws. If we started revisiting airflow, we would have to be prepared to change a lot of what we do, she said. I think it's a good idea, a very good idea, but it will cause an enormous shudder through the Infection Control Society. A group of 36 experts on air quality and aerosols urged the WHO in early April to consider the evidence on airborne transmission. A meeting was arranged with Lydia Moroska, the leader of the experts and a consultant of WHO for a long time. But nothing changed, as a few experts dominated the discussion, insisting that hand washing must be emphasized over aerosols. The group of experts referred to incidents that show airborne transmission of COVID-19, especially in poorly ventilated, crowded indoor spaces. They believed the WHO was placing a distinction between aerosols and larger droplets, but infected people produce both. We've known since 1946 that coughing and talking generate aerosols, said Lindsay Marr, a Virginia Tech expert in airborne transmission of viruses. While scientists have not been able to grow the virus from aerosols in the lab, Marr says it doesn't mean aerosols are ineffective. Most of those samples used in the lab came from hospital rooms with good airflow that would dilute the levels of the virus. She said that in most buildings, the air exchange rate is usually much lower, allowing virus to accumulate in the air and pose a greater risk. Marr also believes the WHO is relying on a dated definition of airborne transmission. Bill Hainage, an epidemiologist at the Harvard T.H. Chan School of Public Health, believes people generally think and talk about airborne transmission profoundly stupidly. We have this notion that airborne transmission means droplets hanging in the air capable of infecting you many hours later, drifting down the streets, through letterboxes, and finding their way into homes everywhere, he said. The experts agree that is not the behavior of the coronavirus. They said the virus seemed to be most infectious when people were in prolonged contact at close range, especially indoors, and even more so in superspreader events, and this is what would be expected from aerosol transmission. Experts believe the WHO should take on a precautionary principle and others called needs and values. This would mean even without evidence, the agency should still assume the worst, apply common sense, and recommend efforts that offer the best protection possible. There is incontrovertible proof that SARS-CoV-2 travels or is transmitted significantly by aerosols, but there is absolutely no evidence that it's not, pointed out Dr. Trish Greenhalgh, a primary care doctor at the University of Oxford in Britain. Dr. Paul Hunter, a member of the Infection Prevention Committee and a professor of medicine at the University of East Anglia in Britain, said aerosols may play a limited role in spreading the virus. But if the WHO were to push control measures without proof, hospitals in low and middle income countries would be forced to use resources from other crucial programs. That's the balance that an organization like the WHO has to achieve, he said. It's the easiest thing in the world to say, we've got to follow the precautionary principle and ignore the opportunity costs of that. The WHO's chief scientist, Dr. Sumaya Swaminathan, said staff members are trying to evaluate new evidence as quickly as they can while not sacrificing the quality of their efforts. The agency will try to broaden the expertise and communications of the committees to be sure everyone's opinion is accounted for. We take it seriously when journalists or scientists or anyone challenges us and say we can do better than this, she vowed. We definitely want to do better.